Hello and welcome as we officially launch FP 2030, our renewed global partnership for family planning. Building on the strengths and successes of FP 2020, we're ready to embark on the next decade of progress. I'm Martin Smith, and I've been honored to serve as Interim Executive Director of FP 2030. Thank you for joining us wherever you are in the world. Please note that subtitles are available in English, French, and Spanish. Just follow the instructions appearing on screen. Over the next 90 minutes, we will reflect on this transitional year that has seen FP 2020 become FP 2030. We will celebrate our new leadership and the renewed commitments to family planning being made all over the world, and examine the challenges ahead as we set our collective intention for the next 10 years. Our global commitments-based partnership has played and will continue to play such an important role in ensuring progress in the continually changing family planning landscape. Earlier this year, we welcomed the first non-governmental commitments, which included transformational announcements from MSI Reproductive Choices and also DKT International, who we will hear from later in the programme. Also coming up, discussions on how we sustain access to family planning in the face of the pandemic and other significant challenges, and the need to harness innovation and creative thinking to meet the needs of women and adolescent girls all over the world. It has been a great honour to be FP 2030's Interim Executive Director during this year. Today we can celebrate the result of this transition, welcoming our new senior leadership. Later we will meet our new board chair, but right now let's join Melinda French Gates, who wants to welcome you all and introduce our new Executive Director, Samkeliso Dube.
Hello, everyone. I'm Melinda French Gates, and I'm so honored to be joined today by many of you who are leaders in your own places around the world as we start to launch FP 2030. It's a new decade for family planning and this partnership. So much has changed since we first came together to start FP 2020. Today, 60 million more women and girls are choosing to use contraceptives than they were nearly a decade ago. So that's great progress, but the pandemic has really caused millions of women to also lose access to contraception and the family planning services that they're telling us they need and they want, and frankly, they deserve to have. So disruptions to newborn and maternal care have led to some of the starkest increases in global newborn and maternal deaths in decades, and that's tragic. And that's why, though, we're all here today. It's clear that our growing partnership has never been more essential. And we're fortunate that so many brilliant women in particular are leading us into the next decade of this work. So I'd like to introduce you to two of them today, Dr. Samkeliso Dube, who, as you just saw, is the new executive director of FP 2030, and Dr. Natasha Kahome, who is the founder of Copper Rose Zambia, a youth-led sexual and reproductive health organization. So Dr. Dube, if I could start with you, you have a large task ahead of you as part of FP 2030. Can you talk a bit about how you see the future of FP 2030 and family planning for so many women around the world?
Fantastic, and thank you for that question. I'm so delighted to be taking on this role, certainly, because for me, family planning is not just about getting the technology in a woman's body. It's about what else can happen when a woman has got agency and has power to decide about her own reproductive health, reproductive choices. And she not only is it power, it's also having the access to the tools that are needed. So that's where we are coming from, Melinda. But in the next decade, what we actually want is to make sure we are reaching those women who we have not been reaching. So geographically, many have been marginalized. They're still marginalized. Something that we call policy evaporation. We have galvanized policies across the globe that enable women to have access, but there are women who we are still not reaching. So in the next decade is making sure we reach those women. Why? How else can we reach those women? Is to make sure that we decentralize the agenda. So the agenda is going to be decentralized into the regional hubs so that we are closer to where the need is around the family planning agenda. And that is why the reorganizing and the recalibrating of FP 2030 is going to be centered around regional hubs. So that's the important part of our programming. COVID-19 has shown us why and the importance of recalibrating. We are saying, as you mentioned earlier, that there are some pockets of programming that we have ignored. We still have some women who are dying. We ignored maternal health in some of the areas as we galvanized energies around COVID-19. So we need to make sure that our organizations are built for resilience for the next decade. And then there is another narrative. Now that we are saying access to family planning, what next? We've got a huge agenda around gender equality ahead of us. How else can we use these tools to make sure that women are involved in economic recoveries, particularly in areas that have been hard hit by COVID-19? So I'm excited to join this because it's leadership that can change and is agile enough to innovate, use technology, get to areas that we have not been reaching before, use data properly for decision making. What else are we not measuring? We want to use data better this time. And also, we want to make sure that there is the next narrative around family planning. What is it? How do we march on towards gender equality when we're coming from family planning, Melinda?
Well, first of all, as you know, I was incredibly excited when you took this role, and I think you're coming at it with a fresh set of eyes. And I really, really like that you are really thinking about the regional and local strategies, because I think those are some of the places that FP 2020 actually made the most progress. Like when we look at the Ouagadougou partnership, I think we should also stop here and say thank you to the Secretariat who worked so hard on FP 2020 and it got us to this point. When you start something new, an initiative as a group and a collaborative, that is not easy. So I want to make sure I give my personal thanks to the Secretariat of FP 2020 as Dr. Dube takes on this next role in the exciting work. So let me just go a little bit deeper, Dr. Dube. You talked about, I love that you're talking about family planning as one of the pillars that then helps with maternal health and then helps with economic development. And it's not just the tools that we help women put in their arms or the medicines that they take or the family planning pills they take. Talk a little bit more about what are some sort of unexpected strategies or places where you see opportunities.
Yeah, so I am seeing opportunities, and again, just to echo those words of say the last 10 years, great work has been done. And opportunity often comes from what you have been doing. So now, Melinda, you can imagine that there are going to be technological advancements that we need to include. How do you access these women? How do they use a cell phone in their pocket to get control and be in charge of their reproductive health? How do you use technology to get newer methods that are not just going to be one size fits all? So technology is going to be a big part of the innovations that we need to galvanize around.
Dr. Dube, thank you for that. And also, I love that you're talking about innovations and the opportunities that cell phones give us, particularly with youth. I think that's a place that there's a lot of opportunity in many countries. Let me bring Dr. Kouame into this conversation. You've done work on sexual and reproductive rights with youth for a long time. What are you seeing as some of the opportunities in FP 2030? Particularly, we call it family planning 2030, and yet youth tell us a lot of times, well, I'm not ready to plan a family. So how do you bring youth into this conversation and meet the needs where they are?
Thank you so much for that question, Melinda, and thank you so much to the FP 2030 Secretariat for having me here. Africa is largely a youth population. It's estimated that 60% of the population is below 35, and globally there are more than 1.2 billion adolescents. Now, in this movement, we need to understand that while youth may be a fixed age, this demographic is dynamic. There are people going in and going out. Now, what that means is that their needs are changing with time. And the solutions that worked for young people then may not be effective right now. A report that was done by Chandra Mouli from WHO showed that peer educator programs, which we've been using for a long time, are no longer effective. So in order for us to remain relevant and continue programming for young people, we need to be quick to evolve, quick to change, and most importantly, we need inclusion in the development sector. For contraceptive use, we need to pull the lever from nice to have to need to do, because the only way we'll see reality on the ground is if we do something drastic. When we look at family planning as a priority, it has implications at macro level and micro level. Macro level in the sense that girls that use contraception will stay in school, they will not be interrupted, they will join the workforce. And with some of the data and statistics, it's showing that $1 invested will yield about $100 in long-term economic benefits. While at micro level, girls that are using contraception are more likely to stay in school, their children will be healthier, and this ultimately pulls families out of the cycle of poverty.
Thank you. That is really, I think, helpful and enlightening, particularly as we think about the youth being so much of the population in Africa, but also so, as you said, so dynamic. I still have a 19-year-old who's in and out of my household, and I just see how things are changing so quickly, even in terms of the tools that they use, right? Both of you, if you could talk a little bit about what COVID-19 has done in family planning and where the opportunities are and where the big challenges are, given that we're all trying to build back from COVID-19. Dr. Dube, maybe we'll start with you here.
What we are seeing, particularly in South Africa, where I sit, we are having sort of an epidemic of teenage pregnancies. And what that means is that we've got a forgotten, so somehow we forgot programming around contraception in this for youth, for teenagers in South Africa. And that in a country that has got good, brilliant policies, we are failing to execute well during COVID. So Melinda, I believe that COVID-19 has shown us that where we do not have hands to execute, where the marginalized keep on being marginalized, where we thought we did have access to contraception and we do not have, we need to strengthen our resolve in using technology, in using media that youth can, especially youth, can access so that they can have access to family planning. I think that, and as she said, contraception, that is very important.
Thank you for that. Dr. Kouame, would you like to come in on this as well, please?
Thank you, Melinda. With the COVID pandemic, I'll be very honest, it was quite depressing on the reproductive health landscape because I saw girls that I know dropping out of school due to teenage pregnancies. There was also increased partner violence. And as a response to the pandemic, some countries omitted family planning from the list of essential services. During lockdowns, women have found it so much harder to access family planning services because they're not listed out as a reason to go outside or a reason to go out of your home. Now, that could have happened due to a lack of diversity among decision makers. The leadership has not been diverse enough to pick up the fact that women need contraception. And yet, when you look at it critically, family planning is one of the best anti-poverty strategies. If a woman can choose when to have babies, that impacts the whole community. Now, in order to best serve the needs of girls and young women moving forward, we need to understand that family planning doesn't operate in a silo. It is part of a larger health system, and strengthening health systems in general could improve family planning. But what we need the most to move the needle is brave and courageous leaders who will sift through ambiguous policies that govern family planning and reproductive health. We need leaders who iron out things like age of consent for family planning services, who iron out data disaggregation for decision-making, and increase domestic financing for family planning commodities. But we cannot achieve all these things without achieving gender equality, because that is what is going to govern how some of these investments are made and who is sitting at the table directing resources to things as important as contraception. So I think for as long as we don't carry gender equality along with family planning and reproductive health, the disparities may still continue.
Well said from both of you. And you are two role models in this as female leaders who see what's actually happening on the ground for women and for youth, and who can help us take policy recommendations and innovations and really make change. I so appreciate both of your leadership on this issue.
Many thanks, Melinda.
Thank you.
As we wrap up, I want to thank you both for sharing your vision for the FP 2030 partnership. I want you to know that our foundation will remain your steadfast ally, and we're proud to be recommitting our support for this growing partnership. You know, the only way to guarantee a more gender equal world is by guaranteeing that women and girls have access to the healthcare and that they need to be able to plan their futures and eventually their families. Family planning is central to realizing women's empowerment and ensuring that women can fully participate in both the economy and in society. And so we're all here because we believe that women and girls should have control over their health, their bodies, and their futures. And that's why this partnership is so important. It's work to advance women's and girls' health and well-being, but it's work that won't just impact women and girls today, but it's also going to have ripple effects in the future for whole families, communities, economies, and societies for generations to come. So I couldn't be more thankful for all the work that you've already put in as a partnership and that you will continue to do going forward. And I look forward to learning more from all of you in the future as we get this important work done. Thank you to you both for joining me today.
Many thanks, Melinda, Samu, and Natasha. Sincere thanks for this clear vision for the partnership and what the focus will be going forward. We're delighted to welcome Samu as the new Executive Director of FP 2030. Coming up in just a moment, our panel discussion on sustaining family planning funding and services. But before that, let's hear the first country commitments being announced today as we are joined by members of the Ouagadougou Partnership.
Bonjour à toutes et à tous. Depuis son lancement en 2011, le partenariat de Ouagadougou a collaboré étroitement avec FP 2020 dans le but d'étendre la planification familiale basée sur les droits en Afrique de l'Ouest francophone. Avec ce lien fort à l'esprit, je suis très heureuse de participer à cet événement afin de célébrer les engagements audacieux, innovants et fondés sur des évidences dans les pays du PO. Ces engagements seront d'ailleurs célébrés et amplifiés lors de notre prochaine réunion annuelle du 13 au 16 décembre. À l'unité de coordination, nous sommes ravis que ce processus dans les 9 pays ait été aussi inclusif que possible et que, grâce à la mise en œuvre du Motion Tracker, cet outil de suivi par la société civile, ces engagements incluent un niveau de redevabilité élevé. Chaque pays du partenariat de Ouagadougou a pris engagement en faveur de la FP 2020 et nous avons accompli bon nombre de choses ensemble. Nous ne comptons pas nous en arrêter là pour autant. Le PO est impatient d'aller encore plus loin dans l'ère de la FP 2030. Enfin, je voudrais souhaiter la bienvenue aux nouvelles dirigeantes de la FP 2030. Nous avons hâte de travailler en étroite collaboration avec vous dans les années à venir et faire de sorte que l'accès à une planification familiale fondée sur les droits soit une réalité pour les populations de notre région et celles partout dans le monde.
Mesdames et messieurs, bonjour. De Conakry en République de Guinée, je m'adresse à vous tous et toutes et vous salue pour partager avec vous en cet instant l'engagement de la République de Guinée par rapport à la plateforme FP 2030. Je suis le docteur Mamadou Diallo, je suis le ministre de la Santé et de l'Hygiène publique. Notre pays, la Guinée, est signataire de la Convention FP 2030 et dans ce cadre, l'objectif que nous nous sommes fixés, c'est de faire passer le taux de prévalence de la contraception moderne de 12,6 en 2020 jusqu'à 18,56 en 2023. Nous allons réaliser cette ambition en nous assurant que nous augmentons substantiellement la disponibilité, la qualité et l'abordabilité des services de planification familiale et nous allons passer de la disponibilité de ces services de 50% au moment où je vous parle à 70% ou 90% à l'an 2023. Nous allons également créer des partenariats dynamiques avec la société civile, les organisations communautaires et les médias afin de pouvoir disséminer sur l'ensemble de notre pays les informations relatives aux lieux où les services de planification familiale sont accessibles, où les personnes peuvent se rendre pour y avoir accès. Nous allons également continuer notre plaidoyer auprès des professionnels de santé, des organisations de la société civile et des acteurs du privé pour nous assurer qu'ils offrent tous et toutes à leur niveau des services de qualité vérifiés, utilisant des produits contraceptifs modernes qui seront disponibles et à un coût abordable. Nous allons enfin travailler avec le gouvernement pour faire passer son engagement dans le cadre du financement de l'acquisition des contraceptifs de 50% actuellement à 70% en l'an 2023. Sur la base de ces différents engagements, nous espérons que notre pays continuera d'être présent sur le plan mondial dans le cadre de la promotion de la planification familiale. Ce combat, nous allons le gagner tous ensemble, chacun dans notre poste, mais surtout en nous donnant la main, en travaillant en réseau et en travaillant en équipe. À vous tous et toutes, je souhaite donc de Conakry, de la Guinée, une journée agréable, mais aussi une journée de réengagement dans le combat que nous menons tous pour promouvoir la planification familiale et la rendre accessible à nos femmes, à nos hommes, à nos jeunes sur toute la planète. Je vous remercie.
Mesdames et messieurs, bonjour. J'ai le plaisir de vous annoncer que le Burkina Faso s'engage en faveur de FP 2030 au regard de la pertinence de la thématique qui est en adéquation avec la politique nationale en matière de santé de la reproduction. Nous nous engageons à rendre disponibles et accessibles les informations et les services de santé de la reproduction et de planification familiale de qualité aux populations en situation de crise humanitaire, y compris les groupes spécifiques, à travers la mise en place d'un mécanisme de préparation, réponse et résilience efficace de 2022 à 2025. Améliorer la disponibilité et l'accessibilité des informations et services de santé de la reproduction de qualité adaptés aux besoins des adolescents et adolescentes et des jeunes dans 100% des formations sanitaires publiques, y compris les infirmeries scolaires et universitaires et les espaces sûrs d'ici à 2025. Sur la base de 12% en 2020, amener 50% des communes à inscrire, alimenter et exécuter une ligne dans leur budget pour le financement des activités de planification familiale d'ici fin 2025. Le gouvernement de Burkina Faso renouvelle son engagement dans cet important partenariat mondial parce que nous pensons que les femmes et les filles ont les meilleures chances de réussir lorsqu'elles peuvent prendre leurs propres décisions concernant leur fertilité. Je vous remercie.
Inspiring to hear those commitments. The Ouagadougou Partnership has been such a key partner during the FP 2020 era and will remain pivotal to FP 2030's success. Stay with us for more commitments throughout the programme. But now let's turn to a pressing question. How do we protect access to family planning funding and services in the face of a multitude of challenges? We have a great panel lined up to consider how best to protect and even increase access to family planning during difficult and challenging times. They will explore new and non-traditional partnerships, private sector engagement, financial prioritisation, and efforts to leverage family planning within the UHC agenda. To open our session, here's Wendy Morton, Minister for Europe and Americas at the UK Foreign, Commonwealth and Development Office.
I'm delighted to celebrate the launch of FP 2030, and I'm looking forward to this important next chapter of our partnership. In our next panel, we celebrate those who have worked tirelessly to support voluntary family planning, even in the toughest of circumstances. Your commitment is incredible, and I'm so grateful for your determination to drive this vital agenda forward. The UK is a passionate champion of sexual and reproductive health and rights. They're fundamental to achieving gender equality and women's and girls' empowerment. We know that they're also crucial to our commitment to end the preventable deaths of women, children, and babies. And we are determined that women and girls should be able to make their own choices about when and whether to have children. Only then can they complete their education, access better economic opportunities, and fulfill their potential. And so this next phase of our partnership is critical to delivering sustainable change in the face of a great many number of challenges in the decade ahead. COVID-19 has pushed health systems and economies to the brink, with devastating consequences for women and girls around the world. And we know that sexual and reproductive health and rights are critical for climate adaptation and resilience. The power of the Family Planning Partnership lies in so many of us coming together to do what it takes to address these challenges over the long term. Our achievements over the past 9 years are testament to that, and we are ready for this next stage of the journey. Together, we can help all women and girls to exercise their rights, enjoy their freedoms, and achieve their potential.
Thank you very much, Honourable Wendy Morton, Minister for Foreign, Commonwealth and Development Office UK, for your remarks. Sustaining family planning and mitigating challenges to ensure smooth provision of family planning services is what this esteemed panel of experienced professionals in health system, gender issues, and beyond will be discussing today. We are privileged to have experts from the United States, the Philippines, Latin America and the Caribbean region, and Uganda. Let me begin with you, Chris Purdy, the president of DKT International. With over 25 years in social marketing and social franchise programs that focus on family planning, among others, how would you respond to those who have said that the private sector, everything from the medical distribution companies to telecommunications corporations, wasn't sufficiently engaged in the FP 2020 partnership? And as we become FP 2030, what should be the biggest lesson learned so we can better engage the private sector in the future?
Thank you, Halima. I think the biggest lesson learned is that we need the private sector. We should not ignore the private sector. The private sector is very important to reaching these goals. From the very start of thinking about how much contraception is delivered by the private sector, I think anywhere between 30 and 40% globally of all contraception is delivered by the private sector. But I think it would be an incomplete picture to look at it only that way, because even those services and products that are ultimately delivered by the public sector, the private sector has a huge role to play. Manufacturing is all private sector. Shipping lines and clearing and all of the supply chain work is private sector. Communications through mass media, TV, print, radio, the brochures that get distributed, these are all the private sector. We should engage private sector actors, including pharmacists and doctors, nurses, clinicians, but also supermarkets, and lots of places where people access contraception. So we need to do a better job of making them feel part of the solution. I know that there's a lot of energy and goodwill and resources that can be brought to bear.
Thank you very much, Chris, for those insightful interjection in this. I agree with you. The private sector has a great role. From you, I think now I would like to turn to you, Dr. Cheryl Gavino, Director of Bureau overseeing family health, infectious diseases, oral health divisions, and the National Immunization Program in the Philippines. We understand the government of the Philippines has put a lot of effort into strengthening the policies for universal health care and further integrating family planning into UHC over the past years. Could you share with us about how this has impacted the coverage and accessibility of family planning services? And again, looking ahead, how do you envision the Philippines' FP 2030 commitment will further strengthen financial protection for marginalized populations in the next decade?
Thank you for this question, Madam Chair. Under the Universal Healthcare Reform, the Reproductive Health Program of the Philippines will be undergoing the following reforms, particularly: 1, more efficient financing for reproductive health goods and services through a purchasing body. Number 2, an integrated delivery of reproductive health as part of comprehensive primary care across the life stage. This will improve the efficiency of service delivery by having the provision and counseling for family planning bundled with other services, such as postpartum family planning, integration with vaccination schedule, antenatal care, and so much more. Third, expanding access to reproductive health through public and private providers. Fourth, inclusive for all women, regardless of marital status, to reduce the unmet need of 48.7% among unmarried sexually active women in the country. And lastly, stronger promotion of reproductive health in various healthy settings and shared responsibility with other agencies. The reform is a continuous process. Universal health care and RPRH to work in the Philippines is a work in progress. And through small incremental steps and persistence, we'll be able to achieve more promising results. And with our renewed commitment to the FP 2030 Global Partnership, this shall galvanize our promises and to achieve our vision for all Filipinos to enjoy a healthy and productive life and are empowered to make informed decisions for family planning.
Thank you, Dr. Gavino. I think these are certainly forward-looking initiatives in ensuring equitable access to family planning services, including reproductive health, and within the framework of universal health care. I bet a number of countries would be learning from the Philippines. Thank you once again. As we continue discussing efforts by both public and private sectors in sustaining family planning programs and mitigating emerging challenges such as the COVID-19 pandemic, we are also joined by Dr. Emma Margarita Iriarte, the Executive Secretary of the Salud Mesoamerica Initiative, SMI, a public-private partnership that provides funding towards attaining health outcomes in Latin America and the Caribbean region. Dr. Iriarte, from your rich experience in strategic alliances and results-based financing for about 2 decades now, what gaps in data and analysis did you find in Mesoamerica Initiative when this initiative started? And what has changed due to the implementation of systematic use of data for maternal health and family planning. Welcome, Dr. Iriarte.
Thank you very much for the question. And Saludos America is a multi-donor trust fund administered by the Inter-American Development Bank and has supported 8 countries in Mesoamerica to reduce equity gaps, including family planning and sexual and reproductive health services. In Latin America, we have, let's say, good averages in terms of contraceptive prevalence use and fertility rates. The huge challenge is that when we look at this data in a disaggregated form, we can see the equity gaps. When we look especially among these figures among indigenous Afro-American populations, vulnerable rural populations of our region. For example, to see the magnitude of this gap, when we started, the contraceptive prevalence rate at national level in Guatemala was 44%. And among the indigenous populations, this was only 25%. That is the first, I think, change that Salud Mesoamerica supported countries is having data at a very disaggregated level with the representatives needed to see what the real magnitude of the problem was. And based on that data, also we discussed with countries that they were lacking information and data for decision making because they were not a population level contraceptive coverage at subnational levels. There was no availability, data on availability of contraceptives at the point of service. Of course, there are data in terms of distribution of procurement, but not necessarily if the family planning methods are at the point of the services. Another issue is data about the quality of family planning counseling, for example, or the estimation of needs in terms of training and developing competences. So the change that the countries generated and implemented through the last decade was first to establish, based on that data, concrete targets at subnational level to decrease the unmet needs, to improve, to increase the use of family planning methods. So some couple of results, after decades, measured at population level externally and measured by routine information data monthly or quarterly. In El Salvador, at the point of service, for example, the availability of family planning methods went from 11% to 71% in only 2 years. And the contraceptive prevalence rate increased 22 percentile points in 4 years, measured through household surveys. So I think the learnings are that using the data, having disaggregated data and with the equity lens, and having this data available at local and subnational level for decision making in how to organize the team, in which the generation of innovations from the local levels are really important to increase the use of the methods and to decrease the inequity gap. Thank you.
Thank you very much. Now turning to Africa, specifically Uganda, a next door neighbor to my country, Tanzania. Dr. Olaro Charles, welcome to the discussion. You're the Director of Curative Services in the Ministry of Health Uganda. You're also the chair of the FP 2030 Country Focal Points, with a wealth of experience in public and private sector partnerships in health, spanning over 27 years now. It's exciting, Dr. Charles, to see the Ugandan commitment on financing for family planning has a clear prioritization of adolescents and youth. It says 10% of maternal and child health resources will be allocated to adolescent responsive health services by July 2025. Could you elaborate on why this was a particular priority for Uganda?
Thank you, Alima, and all the fellow panelists. Over the past decade, the 2 decades, global and national concern of health development of adolescents as researched. This has largely been due to a realization that adolescents, that's 10 years, 19 years constitute a significant percentage of the national populations. Therefore, it's a major demographic force with a significant potential to influence the future of reproductive and maternal and child health trends, but also influence the social and economic development of any country. Adolescents constitute a large proportion of our pregnant women. In Uganda, currently 360 teenage pregnancies occur annually, also which account for the bulk of unwanted pregnancies, which end up sometimes with unintended birth or unsafe abortions. And this will end up in increasing the maternal risk to the mother, but also causing maternal death. So currently, the 15 to 19 years constitute almost 17.4% of our maternal deaths. But also as a country, we are grappling with the very high unmet need for family planning among the adolescents and young people, with adolescents aged between 15 and 19 estimated to be almost 34.4. The unmet need is for family planning at 29.3 for young women, and for young women between 20 to 24 years is at 29.3%. Also, we have restrictive social cultural norms and conservative religious values that expose young people to the risk of harmful practices. In a UNFPA report of 2015 showed that 1 in 2 girls are married before they are 18 years. And at the onset of COVID, because of the measures, schools were closed. This exposed many young people to sexual and gender-based violence and early unwanted pregnancies. So based on the above, it's therefore timely that the conversation with young people for their reproductive, maternal, and neonatal child challenges and needs are put at the center of our FP 2030 commitments.
Thank you very much, Dr. Charles. This is certainly commendable on the Ugandan government for paying undivided attention to the health needs of adolescents and young people. So as we continue with the panel discussion today, I would return to now Chris Purdy once again. The DKT International made a commitment, FP 2030 commitment, which is quite ambitious in its scope, including a pledge to invest $1 billion of discretionary resources, including the procurement of commodities, with sales revenue between 2021 and 2030. Can you unpack what that might mean for various stakeholders, country governments, people using family planning services, and other partners?
Yeah, thank you. So we recognize that there's a big goal in front of all of us, and we've been talking about that for the last few minutes. And big goals require big action. And I think DKT, we're prepared to step up and play our role. We are a service delivery organization. We're in the business of making products and services widely available and affordable. We operate in about 90 countries. And we felt that we could play a big role in helping FP 2030 movement achieve its goals. So we've committed to delivering over the course of the next 10 years, 400 million couple years of protection, and investing and reinvesting about $1 billion or more of our discretionary resources to make those 400 million CYPs a reality. And where it really comes from is that we, although we are a nonprofit organization, we do sell our products. We take the revenues from those products and we reinvest them in buying more commodities. So on average, we're now buying about $120 million a year worth of commodities, implants, injectables, pills, condoms, IUDs, and we put those out into the private sector. We also sell to the public sector. So we're a major provider of these products and services. So we hope that that this is a solution to what we know is also major challenges to financing, structural financing challenges, both from governments, from donors, but also making products affordable for consumers. So that is really what is behind this commitment. We look forward to working with with all actors in the countries where we operate to see how we can create synergies around these services and products.
Mm-hmm. Thank you, Chris Purdy. I think big goals, big drive, big results. I guess you're going to be setting the pace for private sector in some of our countries where their role is a little bit, lagging behind. Thank you. Dr. Cheryl Gavino, many countries in Asia are experiencing natural disasters, perhaps more frequently in recent years. And it might be the case for the Philippines as well. How does the country plan for these strains? And what could other countries learn as they recover from the burden placed on health systems by the COVID-19 pandemic?
True, indeed, no, the COVID-19 pandemic had and will continue to have a profound impact on our lives and the country's health system and economic activities. The Philippines has had difficulty and is still dealing with the effects of the pandemic. Nevertheless, we are recovering and working towards a new and better normal. Even prior to pandemic, during disasters, we have a minimum and initial service package for reproductive health. But during this pandemic, as the health systems shifted to preventing COVID-19 transmission and treating people who contracted the COVID-19, it is essential that we had to ensure access to family planning services. So during the onset of the pandemic, in fact, the Department of Health of the Philippines immediately issued guidelines on the continuous provision of family planning services amidst pandemic, as well as the instruction to health facilities to provide at least 3 months worth of supplies for the contraceptive pill and male condom users, especially those who are in the far-flung areas. Some local government units and implementing partners went even the extra mile to deliver needed family planning services and commodities right at their clients' doorsteps through various family planning on wheels initiatives. And then in support of family planning service delivery, the Department of Health, together with the Commission on Population and Development, and so with the support from the United States Agency for International Development, we implemented a harmonized family planning communication plans and the sexual reproductive health playbook, maximizing online communication and digital platforms for information dissemination and even teleconsultation for family planning services. So for the past years that we have COVID, the Philippines have become adaptive, innovative to bringing reproductive health services to the grassroots amid COVID, amid disasters. So hopefully we'll have more resilient health system for the family planning services as we go on to implementing our adaptive plans and services for family planning.
Thank you, Dr. Gavino. Being adaptive and innovative, planning ahead, stocking supplies way before the crisis hit. I think those are great lessons for a number of countries that are grappling with not only pandemic, but other natural disasters. Thank you once again. Now back to you, Dr. Iriarte. As you know, because of the focus country approach of FP 2020, the previous partnership did not meaningfully engage in Latin America region. As we begin to build new partnerships in the region, what should we keep in mind?
Thank you, Halima. This is a really important question. I would think that there are like at least 5 issues or 4 issues that I like to highlight now. The first one, and as I said before, is despite the national average, because of the inequity gap. We need to make sure that family planning services are available for the poorest, for the most vulnerable and the marginalized populations in our region. And that's especially, that coincides with being indigenous populations especially. The second issue is that it's not only a problem of coverage, but also of quality. And quality of care is essential. Most of women, all of us have had any access to sexual and reproductive health services, but not necessarily, with the quality that we need, especially in terms of family planning counseling. When there is a high level of quality in this regard, then continuity of services is a really, an effect of the quality of services. The third issue I'd like to mention is that from our experience as a multilateral bank, working with ministries of health, we think this is one route for sustainability. And I know, and as Chris was mentioning, the private sector and non-governmental sectors are really important for family planning, but it's critical to remember that when everyone else leaves, the ministries of health are there present in most of the countries, at least in our region, and I imagine in other regions, they are the biggest providers for the poorest populations. The fourth issue is that in addition to reduce inequity, we still have in Latin America and in the Caribbean the huge challenge of working with adolescents. Pregnancy in adolescents is really high here, and we need to work in making accessible in family planning methods and incorporating new methods for adolescent use. And finally, I would say that Latin America and the Caribbean is a living lab in the better sense of the word, of the phrase. We can learning from and within countries and learning from and within regions is important. And that learning and collaborative approaches could shorten the feedback loops of the learning curves in terms of interventions and even failures, successes and failures. So those are, I think, from our perspective, 5 points why Latin America and the Caribbean should be included in any new family planning initiative. Thank you, Halima.
Thank you very much, Dr. Iriarte. I think you bring out the strength of partnership and the fact that in any kind of partnership, there's mutual learning, which means the Latin American and the Caribbean region and the rest of the world will be exchanging a lot of interventions that will benefit users of family planning, and especially adolescent and youth. Now, all the way from Latin America and the Caribbean, I'm back to Africa, and this time, Dr. Charles, back to you. What do you think makes a commitment actionable? And what accountability frameworks or mechanisms will be put in place for operationalizing the Uganda's financial commitment?
There are a number of considerations for a commitment to be actionable. Key among them is definitely political commitment. When political commitment leaders commit to support the commitment, all other supporting factors become much more easier. The other aspect is the appreciation and the ownership of the commitments by the various stakeholders. That's why even during the process of formulating the commitments, we have had a lot of engagement with all stakeholders. Even today when we launched, we left nobody behind. The young people, the legislators, the religious leaders, the cultural leaders, the service providers, the partners, all those are quite important. The Parliament of Uganda, Minister of Finance, and we find that even our commitment is owned by the Minister of Health and also the Minister of Finance, because you need resources. The other aspect for a commitment to be actionable is the aspect of commitment of financial resources, because and this you need from the various partners, from government, because without financial commitment, the commitment cannot be implemented. It becomes more like a wish. The other fourth aspect of it is the clarity to all partners. There need to have reliable and credible data. That has to long been noted to be very important to enhance, so that government partners and IPs have all their efforts, resources to ensure that such a commitment are realized. So in terms of accountability, the Ministry of Health will continue to track the family planning financing through the National Health Accounts tracking studies, which are led by the Uganda Bureau of Statistics. But also as a sector, we encourage independent financing tracking studies by our partners. And this we are working with one of our universities, Makerere University. And then also, we also have the family planning community tracking reports, which will be discussed at various levels, working groups, and we think that this could be some of the mechanisms we can be able to be accountable. And definitely we shall have advocacy activities to continue for increased efficiency in spending, and so that there is ownership, there is partnership, there is involvement, so that we can be able to each of us is accountable for the resources which we have been able to mobilize for family planning activities in the country.
Thank you very much to my panelists. Today, we've been exploring how best we could sustain family planning now going forward as we roll out FP 2030 commitments. And as you've heard, a number of insights and interventions have been proposed: political commitment, gender equity gaps, reducing that, and bringing a multi-sectoral approach to make sure all of these institutions that are implementing the commitments are accountable. Thank you so much for your participation. Thank you to all my panelists, and wishing you well. Thank you.
Thank you so much, Halima, and all the contributors there. There's another panel discussion coming up later, looking at innovations, creative thinking, and new ideas about maintaining access to family planning, as well as asking how to connect with communities we have found hardest to reach. Now let's hear some more exciting FP 2030 country commitments.
Hello everyone. I'm delighted to announce Uganda is making a commitment to FP 2030. We pledge to increase the modern contraceptive prevalence for all women from 30.4% in 2020 to 39.6% by 2025, and reduce unmet needs from 17% in 2020 to 15% by 2025. We also recommit to annually allocating at least 10% of our maternal and child health resources to adolescent responsive health services by July 2025. And we commit to annually ring-fence 50% of our domestic resources allocated for procurement, warehousing, and distribution of family planning commodities from the reproductive health budget by 2025. The government of Uganda is renewing its commitment to this global partnership because we believe women and girls have the best chances to succeed when they can make their own decisions about their fertility. Thank you very much.
Hello. We are pleased to announce Kenya FP 2030 commitment. In our new commitment, as part of this important global partnership, we pledge to increase Kenya's modern contraceptive prevalence rate for married women from 58% to 64% by 2030, and reduce unmet need for family planning for all women from 14% to 10% by 2030.
Hello. We also plan to increase the financing for family planning commodities to cover 100% of the requirements by 2026. We are making this commitment because when Kenyan women can make their own decisions on their fertility, our country benefits.
And there are commitments from many more countries around the world still to come later. UNFPA and the Bill and Melinda Gates Foundation are two powerhouses in the sexual and reproductive health and rights space. Together, they are part of a larger sustaining global movement in family planning. Along with the US and UK governments, these two organisations have helped to inspire, lead and sustain the FP 2030 partnership over the last decade. As co-chairs of the FP 2020 reference group, Dr. Natalia Kanem and Dr. Chris Elias have provided important guidance during a time of intense transition, helping forge a new vision of effective governance. And now they pass the torch to the new FP 2030 board chair.
Hello, everyone. It is a pleasure to be here with you, together with Dr. Chris Elias, who from the very beginning in 2012 served as an original co-chair of the FP 2020 reference group. And this launch event is a testament to the evolution of a family planning partnership like no other. It is about looking to the future, aspiring for bigger results, and pushing ourselves even harder to end the unmet need for modern contraception. As we stay focused on that critical goal, it's also important that we look back and we take stock how far we have come. I'm proud of the work of the FP 2020 reference group. I'm proud of our efforts in charting the course for family planning across the world. And before I turn to you, Chris, just allow me to acknowledge the invaluable leadership of my predecessor, Professor Babatunde Oshotimehin. He passed away in 2017 after serving as co-chair of the reference group for more than half of the time of the FP 2020 partnership. Dr. Oshotimehin, Prof, as we knew him, was a true visionary. He left an indelible footprint on the global family planning community. Thank you, and over to you, Chris.
Well, Natalia, thank you. And I particularly appreciate and want to echo your appreciation for Dr. Oshotimehin's legacy. As you know, for the 5 years I served as co-chair of the reference group with him, we often joke that he was co-chair 1 and I was co-chair 2. He is deeply missed, and he would be very proud of the pivotal role that the reference group has played over the past decade in shaping the global family planning agenda. For me, Dr. Babatunde will always be co-chair 1.
Indeed. And the reference group has been pivotal. It has set the strategic direction of family planning globally. And it's been an honor for me to serve as the subsequent co-chair. And now, with our sights set on the year 2030, we're even more determined to realize that shared vision. It's a world where every woman and every girl can make informed decisions about her reproductive health. And although I will no longer be co-chairing the reference group, I stay energized. I'm energized by the new leadership that's coming to the table. And it's been an honor for me too, to serve as a member of the governing board.
Thank you, Natalia. And on behalf of the Bill and Melinda Gates Foundation, we're very proud to be part of the launch of the FP 2030 partnership. For nearly a decade, the foundation has been working alongside many inspiring leaders to mobilize support for the FP 2020 partnership. from calling for revitalized commitments at the 2017 London Summit on Family Planning to supporting the FP 2020 partnership in building its vision for a new decade, for a new country-led chapter in this family planning movement. I want to thank our fellow reference group members for their leadership and their commitment in supporting FP 2020's transformational work to empower more women and girls to make decisions about their own futures and their own health. Natalia, looking ahead, what are you most excited about?
Well, what I'm really excited about most is the vision as we move forward. That the past couple of years certainly tested our resolve. We've been beset by the devastating impact of the COVID-19 pandemic. We've had to grapple with a concerted pushback against sexual and reproductive health and rights, and not to mention the ongoing threat of climate change, which disrupts and displaces communities worldwide. And yet, our hardy band of family planning partners continues to grow. It adapts, and in fact, it thrives because of that community vision that we hold for 2030. That's what's helping us to galvanize our collective action to overcome any challenge and to continue to drive the progress that women and adolescents tell us that they want to see. We will not stop fighting for rights and choices, for sustainable health systems, and the supportive policy environments that truly leave no one behind. And as the United Nations Sexual and Reproductive Health Agency, UNFPA, dedicated to leveraging our resources and global footprint to support FP 2030 objectives, means that today I'm excited to announce what UNFPA will do, our commitment for the next phase. For the next period, 2022 to 2025, UNFPA plans to allocate at least 40% of our resources towards ending the unmet need for family planning. This will amount to a total of approximately $1.7 billion over that 4-year period. UNFPA will also appoint FP 2030 focal points within all commitment-making program countries. They will provide technical assistance at all levels, including, really important, across the humanitarian development and peace nexus. UNFPA will also lend our support by designating staff to serve on the FP 2030 Governing Board and the associated committees. We move forward together.
Well, Natalia, that's exciting and excellent news. UNFPA's partnership and financial support will be critical to jumpstart the next chapter and will serve the needs of countries and partners throughout the world. And as Melinda said earlier, the Bill and Melinda Gates Foundation is honored to be a partner and an ally to FP 2030. And that's why I'm pleased to announce that the Bill and Melinda Gates Foundation is committing $8.5 million over the next 2 years to the FP 2030 support network. This support for FP 2030 is an important part of the much larger commitment of $1.4 billion that the foundation will invest in family planning over the next 5 years, focusing on supporting a large network of partners, developing new contraceptive technologies, as well as innovative strategies to inform and empower women and girls. We're inspired by the roadmap that FP 2030 has laid out for this decade. It puts countries in the driver's seat, bringing more and diverse partners to the table who are poised to listen to and meet the needs of women and adolescent girls around the world. And we're confident that this bold and transformational vision is setting up the family planning movement to successfully navigate the unprecedented challenges that you highlighted of COVID-19 and to build back a more resilient, gender equal world where women and girls everywhere have the healthcare that they need to plan their futures. Over to you.
Well, Chris, that's a big announcement and a welcome and exciting one indeed. And it also shows the role of leadership. So my thanks to you and to the foundation for stepping up and showing that world solidarity and for also putting the resources to back the rhetoric. So thank you very much indeed. It is now my great pleasure to introduce Honorable Meraseni Vuniwaqa of Fiji. She will take the helm as chair of the new FP 2030 Governing Board. Ms. Vuniwaqa is a visionary leader. She's a champion of gender equality and women's rights in Fiji, in Asia Pacific region, and across the world. In 2014, she became the youngest female politician elected to parliament and was subsequently the first woman appointed as Minister for Lands and Mineral Resources. And then as Minister for Women, Children, and Poverty Alleviation, she introduced a number of inclusive and gender-sensitive policy and legal reforms. Her extensive record of championing women and girls speaks for itself. However, I invite you to read more about her and her background on the FP 2030 website. Honorable Meraseni Vuniwaqa, Chris Elias and I are so pleased to welcome you to lead the FP 2030 family. The floor is yours.
Thank you so much for the warm welcome, Natalia and Chris. It is incredible to hear of UNFPA's and the Gates Foundation's new commitments to FP 2030. What a testament, both to your organization's leadership as well as to the power of this family planning movement to generate such sustained momentum. As co-chairs of the FP 2020 reference group, you set a high bar indeed for how to strategically harness political will and translate vision into concrete action. The new FP 2030 Governing Board owes you a debt of gratitude for your passion, your vision, and your discipline in helping us get where we are today. Thank you. I'm thrilled to be here in my first public event as chair of the new FP 2030 Governing Board. Having led regional consultations to review and reiterate ICPD and Beijing commitments, I understand how the power of a global platform such as FP 2030 can bring us together in a sense of shared responsibility and aspiration. It is my goal to use the lessons of FP 2020 to push ourselves as never before to build toward an ever more accessible and inclusive partnership. That is why FP 2030's new governing board will be made up of representatives from a range of backgrounds: governments, multilateral agencies, donors, global NGOs and civil society, and youth organizations. In order to have a truly representative board, we must have diversity in terms of gender, age, geography, sexual orientation, and background. We need young leaders sitting at the table with seasoned leaders. We need dialogue that is meaningful, nuanced, and enriched by many different backgrounds, worldviews, and life experiences. FP 2030 tells a global story, one in which all partners should see and hear their own stories. I'm sincerely humbled to be stepping into the role of chair at such a pivotal time as we reimagine together what this partnership can be. I look forward to working alongside many of you over the coming years and to write the next chapter. Thank you.
I'm sure everyone watching will join me in extending a warm welcome to our new board chair, Meraseni Vuniwaqa. And sincere thanks, Chris and Natalia. Your commitments to this transformative global partnership are inspiring, as was your leadership of the FP 2020 reference group. And now I'm very pleased to say that we have received several commitments from partners in Latin America and the Caribbean. While FP 2020 focused on 69 countries, FP 2030 is a global partnership that invites institutions everywhere to make a commitment to expand the use of family planning.
Hola, muy buen día a todas y a todos. Mi nombre es Valeria Vázquez. Me complace anunciar que desde Red Flag y Elige nos hemos comprometido con la alianza FPP 2030 En representación de la Red Latinoamericana y Caribeña de Jóvenes por los Derechos Sexuales y Reproductivos, mejor conocida como REDLAC, con presencia en México, Honduras, Nicaragua, República Dominicana, Argentina, Bolivia y Colombia, nos comprometemos para que a finales del 2022 realicemos talleres dentro de nuestra aula virtual sobre derechos sexuales y reproductivos que impacte al menos a 400 adolescentes y jóvenes. También promover la asistencia y la participación activa de adolescentes y jóvenes dentro de los espacios de incidencia, como la Comisión y la Condición Jurídica y Social de la Mujer, número 66, y la cuarta reunión de la Conferencia Regional sobre Población y Desarrollo de América Latina y el Caribe, que tendrán lugar este primer semestre del 2022. En representación de ELIGE, Red de Jóvenes por los Derechos Sexuales y Reproductivos AC, una organización no gubernamental con sede principal en México, nos comprometemos a cerrar el año 2022 con al menos 10 talleres sobre perspectiva de juventudes, derechos humanos y derechos sexuales y reproductivos para 300 servidoras y servidores públicos. 30 procesos de formación para al menos 1,000 adolescentes y jóvenes que permita dotar de herramientas y habilidades para el ejercicio pleno de su sexualidad, reconociéndose como titulares de derecho, pero también como sujetas políticas. Por último, impulsar una campaña para promover la asistencia a adolescentes y jóvenes a los servicios amigables del país. Desde REDLAC y ELIGE nos comprometemos por primera vez con esta alianza global, porque creemos que las mujeres jóvenes, adolescentes y adultas tenemos derecho a tomar nuestras propias decisiones sobre la autonomía reproductiva. Gracias.
Hola, mi nombre es Giselle Carino y soy quien lidera FOS Feminista, una alianza internacional enfocada en las mujeres, las niñas y las personas de género diverso. Tenemos una visión para avanzar la salud sexual y reproductiva desde una visión interseccional y con un compromiso con el liderazgo feminista. FOS Feminista está a la vanguardia en la prestación de servicios de salud sexual y reproductiva. Trabajamos cercanamente con los equipos de salud, también sumándonos a la transformación en los espacios de incidencia política desde el sur global. Estoy muy feliz hoy de anunciar que FOS Feminista formaliza su compromiso con la Alianza Global de FP 2030. Para el 2030, nosotros nos comprometemos a ampliar el alcance de nuestras intervenciones en salud y derechos sexuales y reproductivos a 33 millones de personas en 21 países de América Latina y el Caribe, abogando por leyes y políticas que eliminen las barreras a la salud y a los derechos sexuales y reproductivos, y con especial énfasis en aquellas poblaciones que tienen más dificultades en el acceso a los servicios. Para 2030 nuestro objetivo también es apoyar un total de 270 cambios legislativos y políticos que creen un entorno favorable para el ejercicio de la autonomía reproductiva, apoyándonos en 2 centros que creamos, el Centro de Incidencia basada en la evidencia y el Centro de Respuestas Legales. FOS Feminista se compromete con la Alianza Global FP 2030 porque creemos que las mujeres, las niñas, las adolescentes tenemos mayor posibilidades de tener éxito si podemos tomar nuestras decisiones y nuestras opciones reproductivas. Trabajamos con una mirada similar, con una misión común y estamos muy felices de ser parte de esta iniciativa. Muchísimas gracias.
Hola, yo soy la doctora María Mercedes Vivas, soy la directora de la Fundación Oriéntame en Bogotá, Colombia. Me complace anunciar que la Fundación Oriéntame se comprometió con la Alianza Family Planning 2030. A través de esta alianza, nos proponemos lograr para el 2030 llegar a más de 33.4 millones de personas en 21 países de América Latina y el Caribe, con intervenciones en salud sexual y reproductiva, siempre promoviendo los derechos en salud sexual y reproductiva y derribando barreras de acceso a los servicios de salud. También buscamos más de 270 cambios legislativos y de política pública, con el fin de que niñas, jóvenes, mujeres y personas de género diverso podamos ejercer nuestros derechos, siempre apoyadas con el Centro de Incidencia basada en la evidencia y el Centro de Respuestas Legales. Nuestro compromiso también es en formar una red de jóvenes, de puntos focales de jóvenes, con el fin de llevar a cabo investigaciones lideradas por jóvenes y la promoción regional. Nuestro compromiso financiero se estima en más de $159 millones. Para mí es un gusto anunciar que la Fundación Oriéntame hace parte de la Alianza Family Planning 2030, porque creemos que las niñas, jóvenes, mujeres y personas de género diverso tenemos más posibilidades de éxito cuando conocemos nuestros derechos sexuales y reproductivos y podemos tomar decisiones con base en estos.
Hola a todas y a todos, mi nombre es Yuri Cooper, soy gerente general de la empresa Innova Health Supplies. Nos dedicamos a la distribución de productos farmacéuticos para toda la región latinoamericana y del Caribe. Nuestra especialidad son los métodos anticonceptivos. Hoy nos comprometemos con la Alianza FP 2030 para caminar este nuevo sendero juntos. Nuestros objetivos son dos. Primero, lograr impactar positivamente a 100.000 mujeres de nuestra región al primer año de lanzar nuestras marcas propias en métodos inyectables y orales. Nuestro segundo objetivo es de publicar en los siguientes 5 años el número de organizaciones de la sociedad civil que se benefician de las ofertas de mercado que Innova Health Supplies, en términos de precios más económicos y mejores tiempos de entrega, ofrece a nuestra región. Muchas gracias.
Earlier, you heard our new Executive Director, Samu, urge us to use this renewed partnership to work together to ensure that family planning reaches those who may not have been reached in the past. The COVID-19 pandemic has spotlighted how fragile our healthcare systems may be, putting a tremendous strain on reproductive health services and supply chains. We have had to innovate to ensure that people still had access to family planning information and care. Our next panel is standing by to discuss the power of innovation.
Hello, everyone. My name is Ellen Starbird, and I'm the director of USAID's Office of Population and Reproductive Health. I'm really pleased to be with all of you today and with our panelists, Ramchandra Gairi, Dr. Sabina Imran Durrani, Sally Pearman, and Dr. Anthony Nawala. As you just heard from Martin, each of our panelists is a family planning commitment maker and leader. I'm excited for you to hear from them about how they're taking innovative and creative steps to expand access to family planning and reproductive health services. I also want to share a little of what USAID is doing. From spearheading doorstep delivery of family planning services in the 1980s to supporting the development of almost every contraceptive method on the market today, to using human-centered design and direct-to-consumer approaches to reach young people and respond to their reproductive health needs, innovation has always been at the core of our family planning program and assistance. To mitigate the impacts of COVID-19 on family planning, the Office of Population and Reproductive Health, my office, continues to support partner countries in using innovative approaches such as telemedicine services, mobile applications for contact tracing, and web-based modules for health providers to ensure continuity of care during the pandemic. USAID recently awarded an intelligent forecasting prize to inform supply chain models that can more accurately predict demand for contraceptives. Intelligent forecasting is an artificial intelligence innovation that can help keep contraceptives in stock and improve access to family planning. USAID's leadership in population health and environment discourse is one example of how we are underscoring the role of population dynamics in climate adaptation and resilience efforts, and trying to bring new voices to conversations about issues that are at the heart of our ability to thrive as one global community. As we work together to meet the needs of all who desire family planning and reproductive health support and services, it's vital for us to harness innovative thinking, creativity, and new alliances to expand access and options for everyone, especially the most vulnerable and hard to reach. So let's turn to our panelists now and hear exactly how they are doing this. Ramchandra, the Blind Youth Association of Nepal has worked for years to support the rights of people with disabilities to access the sexual and reproductive health services they need and deserve. To that end, the BYAN FP 2030 commitment mentions demand generation. Programmatically, what does it mean to generate demand among people with disabilities for family planning? And how has BYAN worked with partners to make programs more accessible to ensure inclusion?
Thank you very much for this opportunity to the FP 2030, and thank you for the question. In Nepal, when it comes to the sexual and reproductive health and family planning service to the general people is underserved. When it comes to the people with a disability, these needs are yet to be realized, neither from the parents nor from the government or even from the providers. So people within the disability community, they don't know that there is a SRHR and FP needs for the people. Most of the time, family planning services or the sexual and reproductive health rights are realized and associated with the marriage and the family issue. But when it comes to the disability, parents and the general society even do not realize that these needs should be served with them. So when we started working with the community, like people with different types of disability, mostly with the young persons with disability, we realized that there is no demand, no service-seeking behaviors among them. And when we go to the service centers, the responses that we used to hear is, well, we want to serve this community of the disability, but they never come. And when we work with the user group, why they never go there? Because they think that there is no need for them. Nobody has thought about these things, and the system, communication, materials are not designed in a way that they can access. Parents and other people have only realized that the maximum support for the young persons with a disability is education, rehabilitation, and other medical care. But SRHR things are very less realized. So we started working in both sides. One, we intervene with the supply side through the capacity development of the providers, as well as sensitization and orientation. Whereas in the demand side, we have been working with young folks, young population who are needing service, but their needs are underserved and never spoken.
Thank you so much for that. I think your distinction between underserved and not really even aware is an important one for us to think about. In your commitment of your organization, you state that your organization notes that the exclusion of people with disabilities from the family planning movement is not necessarily intentional ignorance, but sometimes a capacity gap. So how can we build that capacity into family planning programs?
Yes, I'm very happy that you reiterate this sentence, because we strongly believe that the disability inclusion is not an intentional ignorance, because many documents, guidelines, policy documents are very much focusing on this. But now this is the time to translate those international commitments, national laws to the action. And that action need to be started with the consultation and with the discourse with the population with disability. Because many times we see the gap, because providers don't know how to serve the people with the different needs. And sometimes people try to treat them in a different way. And sometimes providers are in a sense of fear that, oh, you know, this, if the deaf people comes to our service center, how do we provide? I don't know the sign language. And sometimes the planners, the donor community, even the civil society organization and governments, their thinking is not wide enough to cover so many diverse population. Let me share you one example. When we think of people with deaf and hard of hearing, what comes in our mind is the sign language. Developing things in sign language may solve the problem. Or for the blind people, we immediately think of Braille. That's a very good thing. But in our realization, that is too narrow approach to deal with. So before we develop the communication materials or our service in sign language for the deaf people, we need to know how many deaf people are educated to understand the sign language, or how many people who are blind or visually impaired actually can read the Braille. So offering Braille to the blind people as an information source is not sufficient. So these kind of things are very much capacity gap. And one of the way to address this gap is by working with people with a disability and focusing on the organization of people with a disability, like Blind Youth Association Nepal. We are just the one. There are so many organizations of persons with disability led by them because they know what is their needs. And sometimes we struggle, and even the donor community, even government are struggling with the data because nobody is generating data, but only asking data. But when we start working with the disability population, partnering with those organizations of persons with the disability, then we know actually what is the tailor-made approach. Where do we intervene and how? Because many people, many organizations are committed. Now they are focusing on the resource as well, but then the capacity gap can be fulfilled by working with the people with a disability because they know what they need, and by working with the organization of the persons with a disability.
Thank you so much. Thank you for highlighting that the will is usually there on the part of the service providers, and also the sort of foundational importance of involving the community that we seek to serve in figuring out how best to serve them. That nothing for us without us mantra applies across so many populations. Thank you so much. I want to turn now to Dr. Anthony Nwala. Dr. Nwala is with the Society for Family Health in Nigeria. And Dr. Anthony, you've helped lead the initiation and scale up of DMPA-CSC and helped revolutionize self-controlled family planning methods, also called self-care, in Nigeria. DMPA-SC has been available for several years now. So what was holding it back in Nigeria?
Thank you so much. Yes, you are right. DMPSC has been, even in Nigeria, has been available for the past 17 years. However, it's just recently that there's been some serious, move for DMPSC in Nigeria. Some of the things that has been holding back this method for us, and in my experience, it has to do with awareness about the product. Both providers and consumers alike did not know about the DMPSC, especially about its use for as a self-injectable contraceptive. And then there were also provider-related issues. There was lack of confidence from the providers in the market, and being a fairly new product in the market, providers focused on what they know. There were no much research to boost provider confidence in administering this product. And furthermore, we also noticed that there was issues from the consumer side. There was fear by the consumers that held back the DMPSC as a contraceptive method. And fear was fear of pain, fear of not being able to inject themselves properly, probably fear of not injecting in the right place, and then maybe the product will not, work as it's expected to. So those are some of the things we noticed. And then in our project, the Delivering Innovation, have tried to address some of these gaps. Okay, we've tried to create a consumer-facing ecosystem based on all the research and insights we've gathered, and the ecosystem offered women opportunity to actually, go to seek information. And beyond the awareness, the ecosystem using a digital companion was able to not just awareness, also offer women a platform to more or less certify health care facility because it comes with a geolocator, and also to have some kind of support training as they go along their self-injection journey. So we are testing innovations with the government, working with the government in some facilities, including patent proprietary medicine vendors, which are low-level health facilities in Nigeria, to boost the train providers who in turn will train consumers, and boost their confidence.
Thank you. Thank you so much, Dr. Anthony. And you started to talk a little bit about the role of the federal government in expanding access to self-care. One important approach that you have noted that the Society for Family Health is taking is this engagement with the government. Why was it necessary to bring the government on board with the self-care approach? And what can we learn from your experience to expand self-care in other settings?
Yeah, thank you so much. For us, the government is like a validation point. When you bring in a product or an intervention like DMPSC, you need to have the backing of the government for providers to say, oh, it's coming from a credible source. The first thing we did, again, you also need policies and guidelines which have been ratified by the government to be able to back up such implementations. So that was very key for us. So the first thing we did was to try and nationalize and adapt the WHO self-care guideline for the nation. And for us to do that effectively, we had to work with the Federal Ministry of Health of Nigeria. And, and this also came, the COVID-19, like you mentioned in your introduction, also created this environment where there was cessation in people being able to go physically to seek services. So bringing in an option where a woman, if trained, can do this at home and reduce the number of times she has to visit the health facilities was an inroad for us to get the government to be interested, okay, in doing this. And one key learning for us by allowing the Federal Ministry of Health to take the lead was with the Federal Ministry of Health bringing together other partners, we were able to get credible partners to join us and pool resources together to be able to, move this forward.
Thank you. Yeah, I think we know historically that a strong policy environment and the engagement of the government can be so important, and I appreciate so much you're making that real for us with your examples. So continuing the thread of involving country governments, I want to turn now to Dr. Sabina Imran Durrani. Dr. Durrani, the Pakistan commitment prioritizes reaching marginalized communities with family planning. Can you say some more about these communities and the innovations that you will be implementing to better include them in family planning programming?
Thank you so much for giving this opportunity to Pakistan, and definitely we have a very high level of commitment, not only from the government side, but also all our partner organizations are very much active, and we are doing a lot, especially to focus and to reach the marginalized communities. You know that in Pakistan, marginalized communities include those deprived from getting the basic health and economic facilities due to multiple reasons. Because of the terrain, there is inaccessibility to hilly and remote and deserted terrain, urban and rural poor, internally displaced and refugees, because it is also a well-established fact that we have a large number of women who are refugees, and definitely they are in need of contraceptive services, women affected by gender-based violence, and those with disabilities and minority communities. Now, marginalized communities tend to have higher unintended pregnancies, which is again a proven fact, leading to higher fertility level and poor health situation. A strong linkages now we are trying to establish with the humanitarian and GBV response teams. Family planning services will be linked to existing vast safety net program. Like, we have health insurance program, we have Benazir income support program, and we have a number of other safety net programs, which we are strongly acting on that to use these different channels for reaching the marginalized communities. Now, partnership will be established, and we are in the process of that with the organizations which are already working with people with disabilities and minorities. Some other important steps to include marginalized communities into FP program include use of digital technology to conduct a mapping exercise to determine their presence, third-party engagement for reaching out the communities, include them in the forecasting and quantification of FP commodities, and incentivizing community health workers so that they can serve this special group of communities also. Nowadays, we are facing one of the most important issue is there is severe shortage of contraceptive commodities in Pakistan, because we are importing all these things and we are facing a number of issues in its procurement. Now, Pakistan is strongly, we feel that we should encourage local production of contraceptives. Once we achieve this, we cater this issue we achieve this target, then we will be in a better position to serve and to provide all across the board. These contraceptive commodities can be provided across the board. Jay.
Thank you. And thank you for sharing the many challenges you're trying to deal with and the ways you are connecting with others to try and expand that access to family planning. In the Pakistan FP 2030 commitment, there's mention of using digital platforms as an accountability mechanism. Could you elaborate a little bit on how that platform will be used?
Yeah, exactly. This is one of our key intervention, and we are very much excited to start this technology and to use it for FP intervention, because this is our flagship program, which I would like to call it. In this program, it is actually based on accountability to ensure the accountability mechanism. And this is going to be an integral part of our FP20 commitment also. Government of Pakistan, in collaboration with all partner organizations, which include UNFPA, USAID, DFID, FCDO, and all WHO and all other organizations, we are in the final stages to develop this national reporting system. The main objective of this web portal is to monitor implementation of CCI recommendation. Just to share that CCI, we have established a federal task force which is headed by President of Pakistan. So you can see the commitment of Pakistan to address this issue. So this task force is headed by President of Pakistan with stakeholders, with key members from all the provinces. They are chief ministers, they are political, and they are political leaders, and they are the bureaucracy. They are a member of this platform. We are focusing not only from service delivery angle, but also tracking implementation of budgetary and policy commitment. Because if we plan for any intervention and without budget, so it will be very difficult for not only for the federal government, but for the provincial government for its implementation. So we need sufficient budget, and in this web portal, there will be a mechanism that everything will be clear, that how much money, budget we have in our pocket, so that we can plan accordingly. It is going to be the first of its kind. And this important data source will be fully functional and available for monitoring and accountability by different leadership, which include both federal and provincial stakeholders, our CSOs, our parliamentarian media, everybody who wants to have an access to this mechanism. It will be, easily reachable to them.
I really appreciate the examples, and congratulations to Pakistan on moving in this direction. I think the availability of the easy access to data and transparency are so important in a successful family planning program. So congratulations. Finally, I'd like to turn to Sally Pearman. Sally, the International Confederation of Midwives' commitment to FP 2030 calls attention to the critical role that midwives play in promoting access to quality care throughout a woman's life. Midwives are not only central to supporting women before, during, and after birth, they're on the front lines of reproductive health care, a role that has become even more critical during the pandemic when it's harder for more people to access care. So what innovations are you hearing about from midwives regarding their efforts to uphold access to family planning during the COVID-19 pandemic?
Thank you, Ellen, and thank you for the opportunity to be part of the panel. Well, pandemic or no pandemic, midwives have always been and always will be disruptors and innovators and advocates for sexual and reproductive freedoms of women. We know that COVID-19 has disproportionately impacted women and girls and been especially disruptive to the sexual and reproductive health sector. So around the world, we're hearing from midwives that workforce shortages, reduction in pharmaceutical supplies, depleting health finances, prioritisation of COVID health service responses have all contributed to a disruption or stoppage of essential primary health services. And as a result, many women haven't been able to access basic reproductive services such as family planning support, post-abortion care, maternity services. And we are already seeing an increase in unwanted pregnancies. And speaking with our member associations, it's clear that the midwife responses to the pandemic is really using an increased use of virtual technologies for practice. For example, midwives have undertaken antenatal and postnatal assessments, including, of course, family planning support and post-abortion care, using their mobile phones and video conferencing technologies. In Northeastern Africa, the South Sudan Nurses and Midwives Association established a WhatsApp group for members of midwifery associations across 6 countries to strategize on how to protect and support themselves and women while staying informed about evolving WHO guidelines. And that is an example that is quite a common one. And midwives have also reported that they've been providing more care in women's homes, especially as women have been much more reluctant to go to centralised health facilities. They've been frightened to do that. So midwives have been visiting women in their homes, but sometimes standing outside, speaking through windows to see the woman and her baby, and being careful to protect them by not coming inside. And of course, an important component of a midwife's care is to provide advice and facilitate informed decision-making, including about family planning options and how to access contraception. Some midwives are able to prescribe in some settings, able to prescribe contraceptives, and others, they've been able to bring supplies to women where they live. Midwives have been strong advocates for increased recognition that maternity services and family planning services are primary health services and need to be based in communities near where women live, where they're more likely to remain accessible in pandemics or other crises than in centralised facilities, because we know that those have not all remained accessible during the COVID pandemic. And our hope is that the use of virtual technologies and increased understanding of the importance of community-based maternity and sexual and reproductive health services will remain beyond the pandemic to provide women with safe and secure channels to access their midwife and quality family planning resources. And you could also say that the midwife-led continuity of midwifery care model of practice is an innovation of itself. So this is where a woman has access to a midwife or a small group of midwives across pregnancy, early pregnancy, labour, birth, and the postpartum period, the whole childbirth continuum. And they have built knowledge of that midwife, they get to know each other, they trust each other. And the research evidence is that the outcomes of that kind of model for each woman and her baby are significantly improved.
Thank you very much. I think you highlight so nicely the importance of data, the importance of providers, both as a source of care, but also as a source of information about the community and a source of innovation in how we can move forward. The ICM commitment has partnership at its core. Can you elaborate a little on how ICM plans to build a midwifery movement. I think you started to talk about that a little bit, but perhaps focusing on working with established partners as well as new and unexpected allies.
Yeah, for sure. Thank you. Our 2021 to 2023 triennial strategic plan places a great deal of emphasis on driving innovation and sustainability for the future of midwifery. And our ability to shift perceptions about who midwives are and what they do is predicated on being able to promote the value of midwives to prospective regional and global partners and allies. So establishing and nurturing global partnerships is fundamental to the impact that we can have as an organisation. ICM has a unique and vital role because we're the only organisation that's specifically focused on supporting associations of midwives and their midwife members around the world. And it's through our partnership with midwives associations where real change and growth occurs for the profession and for individual midwives. So whereas ICM has strong global relationships with international partners and donors, it is our Midwives Association who maintain and establish relationships with on-the-ground decision makers, ministries of health, for example. And when we talk about ICM's FP 2030 commitment and our efforts to improve quality of care and access to sexual reproductive health services for women, we're really talking about our work to strengthen and support the more than 140 midwives associations that we represent globally. Additionally, a lot of partnership building that's referenced in our commitment will be achieved by our work on the PUSH campaign. This is our decade-long initiative to accelerate progress on reducing maternal and neonatal mortality, advance sexual reproductive health and rights, address key barriers to women's leadership in the global health workforce, and shift underlying gender norms that undervalue women's rights, lives, and work. PUSH, our PUSH campaign, will demonstrate the ways in which midwifery intersects with and advances the full spectrum of feminist issues, such as access to abortion, gender pay equity, and women's representation in leadership roles. And we're confident that this approach is going to lead to new partnerships with women's groups and individual women who will benefit directly and indirectly from midwifery.
Thank you. It's very exciting, and I love the idea of a PUSH campaign from midwives. Thank you, Sally, and thank everyone for your bold commitments and for sharing your insights with all of us. I'd like to wrap up with one last question for all of you. Sally talked about a nurturing partnership and crowding in. And so I wanted to ask how each of you sees how FP 2030, as the biggest convening partnership in the family planning movement, can better engage with your organization and constituency. What are you looking for from FP 2030? Ram, would you like to go first? And could I ask you to keep your answer to about 30 seconds?
Yeah, sure. Thank you. We are so good at documents and policy. Let's plan to translate that. Let's budget it. And one of the way to reach to those hard to reach population, as you said and we say, is by ensuring the accessibility. Let's do our accessibility audit in our each institutions, how inclusive our interventions, not only in the documents, but in the programmatic part, as well as in the budget. One of the ways that FP 2030 can convene to its global partners through the accessibility audit approach, designing some indicators to make people more inclusive. And accessibility is not just for the people with the disability. This is the design of universal. This is the principle of universality. So when we think for all, and when we think the FP services for everyone, I think that is the way we can think in a designing universal way. That's the spirit of leave no one behind principle.
Thank you. Sally, would you like to go next?
Sure. I mean, I think that FP 2030 has got a really big opportunity. You, as you say, you are the biggest convening partnership in the family planning movement. And so you can support ICM in achieving our commitment by creating more platforms and opportunities such as this. bringing together like-minded organisations across different sectors and helping us in helping everybody to foster new relationships to take our commitments forward.
Thank you. Dr. Durrani, how about a perspective from you?
Actually, we are facing this issue of population since long, and across the world we are working on that. So I think this is the time that we must think something out of box thinking is required. Number one. Number two, we must learn from each other's experiences without reinventing the wheel. We should find it out that what exactly matters and how it works. And another thing is that, that we are mainly focusing on family planning, reproductive health, contraceptive. These are the three areas. But I think population is a multi-sectoral issue. Now we must focus, and government of Pakistan is strongly focusing on that, linking a population issue with your climate change, with your planning and development, with your nutrition, with your health, because it's an old thing that just reduce the size of your family, do this thing and do that. I think out of box thinking is much needed. And this is the time that we should focus on, especially in developed world, like linking it up with your other issues, because population is not a single issue. It is a multi-sectoral issue with multiple impact. And if we will not address those issues, that I don't think so that we will be able to manage this issue across even not in my country, but across the world. Thank you.
Thank you. And Tony, what would you like to add?
Yeah, she took part of that almost from me in terms of reinventing the wheel. So for us, one key area that we could be better supported is by collaboration with FP 2030 to create a knowledge sharing platform. This is bringing a global perspective to what you do always helps. So if we can know what has worked, or what has been learned in other climes, it will be very, very beneficial for us while we work and try to move along to shape and strategize in our implementations.
Thank you. Thank you very much. I appreciate both the perspectives you brought from your own organizations and countries, and this larger perspective each of you just took in the closing about what will make the movement successful. And I very much look forward to being part of this with all of you going forward. The opportunity is here now in front of us to take significant steps to reach those who have historically been overlooked and to channel emerging ideas and innovation to improve contraceptive choice and access for everyone who wants it. It's time to move forward together. Thank you all very much for joining, and I'm going to turn this back over now to Martin.
Many thanks to Ellen and the panel there. It's inspiring what we can accomplish to overcome barriers. This family planning partnership is stronger for our diverse allies, from small community organisations to large international institutions. We are so glad to have a greeting from Dr. Tedros Ghebreyesus, Director General of the World Health Organization.
Dear friends and colleagues, the COVID-19 pandemic has disrupted essential health services in many countries, including for family planning. The pandemic has also demonstrated the centrality of health and that global challenges require global solutions. The launch of Family Planning 2030 is an opportunity to expand and improve our collaborative work on family planning. Family planning and contraception, including postpartum and post-abortion services, must be recognized as essential health services and as critical for reducing gender inequalities. WHO is fully committed to reducing inequities in access to family planning services for all people, especially those living in humanitarian settings, for migrants, and for other vulnerable populations. One way we're doing that is with guidance, tools, and training materials based on the best available evidence on the safety, quality, and choice of contraceptive methods and services. We also offer technical support to monitor progress. Our recommendations for maintaining family planning services during the pandemic have included self-care, telemedicine, empowering pharmacists, and bolstering community health workers. WHO remains committed to working with you to protect and promote the right to health, to increase the proportion of women who have their need for family planning satisfied with modern methods, and to create a healthier, safer, fairer future for all of us. I thank you.
Thank you, Dr. Tedros. We truly value our collaboration with WHO. And now, our final commitments for today. The International Planned Parenthood Federation collaborates with partners all over the world, including with many of you watching. Touch the Heart Uganda works with young people to help them become fully empowered and committed to gender equality. With other NGO commitment makers who have spoken today, they represent just a glimpse at the range of geographies and perspectives that make this such a powerful partnership.
My name is Ian Chikomiko, and I'm the team lead at Touch the Heart Uganda. And as a youth-led organization, we are so excited to be here today to celebrate our FP 2030 commitment and those of many countries and organizations. As part of our commitment, we pledge to build internal government support for financing and accountability mechanisms to ensure accessibility to family planning commodities. We plan to engage policymakers in Parliament, Ministry of Health, Ministry of Gender and Social Development, Kampala Capital City Authority, and the district officers. We also commit to create more awareness on family planning among adolescents and the variety of different family planning methods to suit their lifestyle and goals. We plan to link young people with service providers to provide adequate counseling and service provision, to address their reproductive health needs and according to their own desires and lifestyle. We hope to reach about 3,000 adolescents throughout a period of 5 years. As a youth-led organization, the need and the lives of young people are at the forefront of our commitment and at the center of everything that we do. And I'm also pleased to be here with Dr. Alvaro, the Director General of International Planned Parenthood Federation. Dr. Alvaro, can you please elaborate more on how IPPF made sure that young people were included in your commitment process?
Thank you, Ian, and a warm welcome, Touch the Heart Uganda, to this important global movement. IPPF is proud to have been part of it from the very early days of FP 2020. Ian, you asked me about how we engage with youth. Young people make a significant part of our global and national governing structures. They guide our strategic planning process and our advocacy. And they participate in program design and delivery. We are so happy to see young people gaining space in FP 2030. We're also happy that FP 2030 will expand to new countries and regions, including Latin America. Family planning and sexual and reproductive health are increasingly under attack around the world, and we need to amplify our voices, to hold ground and to advance our work. IPPF's FP 2030 commitments includes a clear focus on equity, including equitable access and quality for young people. Let me read our commitment. By 2030, IPPF will increase access to client-centered and rights-based contraception in at least 102 countries, provided through member associations. We will focus on reaching the low-income communities, marginalized populations, and people living in humanitarian settings, with specific attention to young people and adolescents. We will ensure individual choices are met through advocating for commodity security and through providing a wide range of contraceptive options. We will also seek to expand innovative and gender transformative strategies, including digital health interventions and facilitated self-care, alongside, of course, on-site service provision that responds to people's needs. We will further strengthen data and clinic management systems and promote data utilization across member associations in order to inform program and management decision-making. We will proactively advocate for legislative changes in support or defense of SRHR and gender equality in 42 countries. That is the commitment, and I make it with some trepidation. It requires that donors joining FP 2030 support the movement not only politically, but also through a strong financial investment in delivery of contraceptive services. IPPF is still reeling from the devastating service delivery impacts of the brutal UK cutbacks. At the same time, IPPF and our member associations, who are very much local partners in the US government lingo, are working to rebuild relationships with USAID and with USAID partners after the vicious global gag rule imposed during the Trump administration. To expand sexual and reproductive health and rights, our partners around the world require coordinated, sustained support. We're glad to be a part of this community that jointly calls on donors, governments, and other stakeholders to renew and to re-engage in the global imperative of a rights-based family planning agenda for all. Thank you all.
Thank you all for joining us today and for your continued collaboration and partnership. I hope the discussions and commitments we have heard today have inspired you. This has been an incredible year of transition, and we are not quite done yet. In early 2022, we will announce the locations of our 2 FP 2030 Africa hubs, 2 of the 4 regional hubs that will be established in the next year. But for now, I want to hand over to our new Executive Director and Board Chair to close today's proceedings and wish you all the very best as we move forward with FP 2030.
Thank you, Martin. I'm so inspired by what we've seen today. One commitment after the next from governments across the globe, non-governmental organizations, multilateral partners, civil society groups, and youth-led organizations. We have welcomed long-standing FP 2020 partners and those who are completely new to this arena. What a remarkable display of solidarity and momentum. It is truly invigorating to see this all come together.
To all of our commitment makers, a heartfelt thank you for taking the leap with us into the next iteration. You're welcome here. FP 2030 is home to all who want to be here.
Today, we also had fascinating conversations, leading off with Melinda French Gates and Natasha Kaoma, continuing with a vibrant panel on what it will take to sustain family planning, exciting announcements by FP 2020's former reference group co-chairs, and culminating with a dynamic panel on innovations in family planning. Today, we took one small but very significant step toward realizing this vision. In officially launching FP 2030 today, we have set the wheels in motion for the next decade of dialogue, yes, and of action.
As you have heard today, the work has arguably never been more important, and the challenges are daunting. But I, for one, am so heartened by the spirit and resilience that is FP 2030. I'm confident our best years are ahead of us, and I'm thrilled to be a part of it.
So much needs to happen behind the scenes to pull off a production like this one. I would like to express my deep gratitude to all those who worked tirelessly to make this event happen. And thank you to Martin for being such an excellent and gracious host. Most importantly, thank you for taking the time to be here today and for showing up in so many wonderful ways. We look forward to many years of fruitful collaboration. onward
to 2030. Thank you.
Thank you.